All right, welcome back to video number 4 of our lateral elbow pain series, where I'm going to be taking you through some activities and exercises that I teach people here in the clinic on how to improve the tendon and the muscle's ability to accept the load or demand that you're putting on it, also known as strengthening. All right, so you've made it back. If you haven't seen video number 1, 2, or 3 of this series, I'll drop the tag right up top here and you can click that and follow along the series so that you can go over video 1, which is a self-assessment to see if, hey, is nerve pain mimicking the lateral elbow pain? And then video number 2 is teaching you some pain and sensitivity reduction using tools such as cupping, a massage gun, your hands, and then also a lacrosse ball to help desensitize that sensitive area. And then video 3 is where we went over some stretching for the extensor muscle group in the forearm and then also the flexor group in the forearm. So if you haven't seen those, click the link and follow along from there. For everyone that stuck around, and here we are at video number 4, this is where the meat and the potatoes are. This is the bang for your buck because this is that long-term fix that most people are looking for. Videos 2 and 3 are more of that improving muscle flexibility and also reducing sensitivity or pain so that you can tolerate a corrective program to help improve the tissue to accept the forces that you're putting on it. Before we get into any of the strengthening exercises and activities, I want to first talk about 2 key points. Key point number 1 is that typically in a good portion of my clients who have elbow pain or even lateral elbow pain, the elbow pain site is not the sole cause of why somebody may be having sensitivity or pain there. A good number of people have symptoms because somewhere along the chain, whether it be in the shoulder and scapula girdle, maybe it be in the spine, like the thoracic spine, or a little bit of all of the upper quarter muscles and how people tend to use them regarding strength, flexibility, all of that. So I do a detailed evaluation with somebody with lateral elbow pain. It's not like I'm gonna zoom in right onto that elbow unless that is solely the only thing that's the problem. The site that is tender and painful can't handle the load because it's making up the difference for another muscle group in that arm that's not doing their job, causing your elbow to do more work. So it's kind of like having a team at work. You have 3 people on your team and 2 of them go on vacation and 1 of them's left to do all the work. Eventually that one doing all the work is gonna get pretty irritated. So nonetheless, the same type of scenarios apply. However, it's not in all cases, but a good number of clients do have compounding things that need to be addressed. So if you feel that's you, by all means, go be seen by a clinical professional, get evaluated so that they can further help you reach your goals and improve the symptoms that you may be having. Or heck, come see me if you're in the local area. So key point number 2 is that you have to take into account what activities or movements that could be contributing to your discomfort or pain, or causing so much stress to the outside portion of your elbow, causing tendonitis, inflammation, sensitivities and pain. You've got to look at the movement because if you don't correct that, then your progress is going to be much slower because you're continuing to aggravate it and basically rip the scab off of a wound that's trying to heal itself. So looking at your movement patterns, seeing what you're doing that could be contributing to the pain and irritation. Common problem with that as far as movement is keyboard setup. If you're working at home or working at a desk and behind a computer and keyboard, having good ergonomic setup is going to be ideal in reducing stresses that you're placing on your body. Just remember the 2 key points. 1, don't solely focus and zoom in on the elbow as the problem. If you're looking for a shoulder stability and exercise strengthening routine that I typically use a lot here with my clients, I'll click a link right here up top and you can go through my 3 video series for shoulder pain. And that'll be very helpful in improving flexibility in the shoulder and strengthen the shoulder blade and even in the shoulder. And I think there's a bonus in there too, which works on the upper thoracic spine to help improve mobility, which correlates to better shoulder movement. And then key point number 2, obviously, is what we just went over, is movement. Assess your movement, see what's contributing to it, make some adjustments, and continue to improve from there. I just want to let you know this is not medical advice. This is for educational purposes only and for me sharing with you a little bit about what I do here in the clinic with some of my clients who may be suffering from that lateral elbow pain. So today, I'm gonna be taking you through some strengthening exercises. First, starting off with some isometric strengthening exercises. Then we'll move into some repetition exercises. And then finally, we'll finish off with gripping exercises. All right, so let's get going. And we're gonna start with isometric exercises for your wrist extensor muscles, which are found on the top side portion of the forearm. Isometric means that there's no movement going one way or the other. It's just a static position with resistance, and you're not moving. It's an effective way to help load the tendon without a lot of stress on it. So let's start with the isometric. Here we go. What you're gonna need is a towel, just for a little bit of padding, and then also some resistance. I'm using a dumbbell. You can use a dumbbell, a kettlebell, anything that you have that you can hold with your one hand and provide a little bit of resistance. When it comes to the weight, we'll get into a scale that lets you know when you're doing too much or when you can continue on. So here we go. This is how you perform it, and then I'll talk about the scale in just a second. So you're gonna use the weight palm down, but you wanna hold the weight in your fingertips. So you're gonna grip from your fingertips first and then grip into the weight. You're gonna rest your forearm off the edge of the table, and you're gonna slightly extend and bring your wrist up. You don't wanna be all the way at the peak. You just wanna be slightly bent. Slightly bent, not all the way up, not down and flat, slightly bent. What that does is it puts your wrist in a good mechanical position, and you're gonna hold this for a duration of time. I recommend starting off with 30 seconds up to a minute if you can tolerate it. So now let's get into the scale I was talking about. Let's call it a traffic light scale. Red, yellow, and green. So what does that mean? Red means you're gonna stop, yellow means caution, be aware, and then green means continue to go. You're doing fine. So on that scale, let's picture a number scale, 0 to 10. And we're gonna color code it, right? 0 to 10. 0 meaning no discomfort in your elbow when you're doing the exercise. 10 being painful, no go, I have to stop, I wanna drop the weight, it does not feel good. Your green zone is gonna be the 1 through 3. So that means if you're gonna lift up and you feel a little discomfort, maybe it's a 1 out of 10, 2 out of 10, up to 3 out of 10, that's your green zone. Keep going, you're doing fine. Finish your sets and reps in the time duration that you allot for yourself. But if you get into the 4 out of 10 discomfort, all right, now you're hitting that yellow zone. That means caution. It means you're kind of borderline, you're doing okay, you can continue, but nonetheless, if it jumps into the 5 and more, that's hitting the red zone saying stop, you're adding too much stress to the tendon and it's causing you a little too much discomfort at that time, all right? So that's gonna be the scale that you take through with all of your training regarding the lateral elbow pain. And you'll find out that that scale can actually be used clinically through a lot of different things people are recovering from. That scale is what's gonna be used to determine, do I continue? Do I wait, or do I go? And we just completed the isometric for the wrist extension muscles. All right, so let's move on to the isometric wrist flexor exercise. The wrist flexors found right here on the front side of the forearm. It's gonna be performed the same exact way, but now your palm's gonna be facing upward. And what you're gonna do, grip it in the fingertips, good grip, slight flexion so that you have a little bit of crease here. You're gonna hold that for a duration of time, up to 1 minute. Build up your tolerance if you can't tackle the 1 minute right off the bat. Use the method of red, yellow, green on when to proceed, when to slow down, and when to stop. You're gonna hold that and then relax, place the weight down, rest for a minute or so, and then repeat. The goal is 3 repetitions for 1 minute hold. Once you've done that, that's completed the flexion and extension portion. Now let's get into the supination, pronation, meaning palm up, palm down motion. For this exercise, I'm gonna use a stick. This one is weighted for 1 pound. It's a therapy stick. You can use a hammer, you can use a dowel, anything that you can have a little bit of leverage on and have a little bit of weight on the outside of it. So if I was to use a dumbbell, I would just hold the bottom portion of it. Therefore, I do have a little bit of weight at the end here. So in order to work the supinator muscles, which are found in the outside portion of your forearm, you're gonna hold the stick and turn your palm down. You're gonna hold this position, slight extension with the wrist like we did in the first exercise, and you're gonna hold this 30 seconds to a minute for 3 sets. Same red, yellow, green light apply. All right, you're just gonna hold. Once you finish that, then you're gonna flip it on over, palm up, slight flexion and bend with the wrist, just a little bit, and hold this position. That's gonna work your pronator teres on the flexor muscles. That'll help strengthen it and also provide some resilience to those tendons. All right, so that's how we've gone over the isometrics for the flexors, extensors, supinator, and pronator muscles. Now that you finish the isometrics, the next step, the next level is gonna be your repetition exercises. It's the performance of the same exercises, but now you're performing repetition. All right, let's go into the repetitious exercise. So we're gonna be using our dumbbell for the first round, and then for our supinator and pronators, we'll be using the stick. Here's what you do. You're gonna grip right in the fingertips, make a fist right around it. Rest the edge of the table on this portion of the wrist. You're gonna lower the wrist down like that. And here's where the repetitions come into play. Come all the way up as high as you can, and then slowly return. Come up as high as you can, and you're gonna repeat this. Once again, you're gonna use that same red, yellow, green light scale to let you know, do you proceed, do you slow down, or do you stop? All right, so this should be targeting those wrist extensor muscles right through here. The wrist flexors found right here on the front side of the forearm. For the wrist flexors, you're gonna make a grip and then lower the weight into your fingertips, then making a fist and curling up. So the goal for those exercises, 3 to 5 sets, 12 repetitions is a good place to start. You can always go up to more repetition. You can always increase the weight, decrease the weight. So just know that expectation with strength training and building the load capacity of muscles is that you're gonna have some muscle soreness. That lactic acid built up, you're gonna have a little muscle soreness and a little bit of fatigue after doing the exercises, but that soreness shouldn't last more than, let's say, 24 hours. It's a safe place to say, hey, you did enough to build up some strength. If it starts lasting 2, 3, 4 days, that's what something we would consider is that you overdid it, and I would turn the intensity down a little bit. Maybe cut the reps in half, maybe cut the amount of sets you did, bringing it down so that you can have roughly about no more than 24 hours of muscle soreness from exercise. All right, so that's how we perform the repetitious for the flexion and extension. Now let's go over supination and pronation. So with this one, we'll be using the stick again. You'll grab the end of it just like so. So once again, hand off the edge. All right, so now you're gonna grip with your fingertips right on the edge, stick facing straight up. So with this one, we're gonna be working the supinators and pronators, which is the inside and outside portion of the forearms. So you're gonna be doing both of them with one motion, and that's because of gravity. But nonetheless, we won't get nerdy on you, and we're just gonna go to neutral, back all the way around to neutral. 3 to 5 sets, 12 repetitions is a good place to start. Okay, so now that we've gone over some of the repetitious exercises for the wrist flexors, the wrist extensors, the supinator, and the pronator, I want to also show you one other motion in the wrist that does affect the muscles that cross the elbow, and that's going to be your deviations, your radial and ulnar deviations. So what you're going to need for this one is also the stick or a dowel or a weight. So here's how you perform these repetitious exercises for these two motions. Grab the stick with the fingertips, make a grip, elbow by your side, keep it straight, shoulders in a neutral position. You're not like slamming them up, not slamming them down, not slamming them back, just keep them in a neutral. Then what you do is go up and down with the wrist. And for the final repetitious exercise for this program series is gonna be grabbing the stick with your palm up at the edge, having the stick going towards the back. And you're gonna go up and down just like this. All right, so what that's done is it's addressed all of the specific muscle groups that cross the elbow from the forearm that could be contributing to weakness and muscle performance, causing you to have an irritation at that outside portion of the elbow. All right, one bonus exercise. This one's gonna tie in all of it together regarding your wrist extensor muscles, your scapular shoulder blade muscles, and then also some rotator cuff muscles that are important for improving stability in the upper arm and helping you fix that lateral elbow pain. So what you're gonna need is a resistant band loop. If you need one of these and are looking to pick one up, I have some here in the clinic. If not, I have an affiliate link down below. Go ahead and click that and you can pick up yourself a resistant band. So here's how you perform the exercise that I'm talking about. You're gonna first start with the band around your hands, not the fingers yet, just the hand inside the thumb there. All right, so what you do is you're gonna bend your elbows 90-90. You're gonna keep your wrists in that neutral position. All right, slight bend, neutral position. You're gonna apply resistance to the band just like this. Just kind of gently put those shoulders back in a neutral position. Stretch the band like this. All right, you ready? Maintain that wrist position and tension on the band as you reach up to the ceiling. And then you're gonna come down the same way. Here we go again. Keeping the tension on the band, wrist stay in that neutral position, elbows stay inward. You will find if you're doing this correctly, the outside portion, the wrist extensor muscles should be on fire. Your middle shoulder blade muscles between the shoulder blades should be on fire. Those rotator cuff muscles on the back side of the shoulder here, your infraspinatus, we're not gonna get nerdy on you, but nonetheless, those muscles should be on fire if you're doing this correctly. It's an easy way to tie in the entire chain so you can strengthen the scapula, the shoulder, and also those lateral elbow extensors, giving you improved load capacity and strength of your wrist elbow extensor muscles. Now that we've just concluded with the repetitious exercise, it gets fun because the possibilities are endless. Let's take into account gripping any type of gripping exercise, whether it be a grip with a row for those back muscles, whether it be a pull down, be a shoulder press, a chest press. Every time you're gripping something and moving it, you want to be mindful of the wrist position and the movement pattern that you're using. Any type of gripping exercise, whether it be carrying kettlebells, dumbbells, weight, water bottles, it doesn't matter. Gripping exercises and all upper body strengthening exercises will be helpful in improving wrist strength so that you can improve that lateral elbow pain. So at that point, the possibilities are endless as long as you're able to maintain that neutral wrist position and not put yourself in vulnerable positions causing more stress than needed. So get out there, strengthen the wrists, strengthen the forearms and elbows, and strengthen above it, which includes the shoulder. So this concludes our lateral elbow pain series. Just remember that this is not medical advice. This is for educational purposes. However, I get to show you a little bit about what we do here in the clinic. So I hope this program was helpful for you. This concludes our video series. I will be back with more content. I hope you guys are all doing well. And thanks for tuning in to Help You, where I help you with movement, self-improvement, pain management, so that you can live your best active life. I'll see you guys in the next one.